A very warm welcome to all of you joining us today at UMCC Medical Consultant Connectors. Here, we believe that your health truly matters to us. Our mission is to provide clear, reliable information to help you make informed decisions. Today we're focusing on a medication called Vagid CL. Many people have questions about it, and our goal is to answer them simply. So, what exactly is Vagid CL? It's a combination medication prescribed for certain vaginal infections. It's used for syndromic treatment of vaginitis. It targets common culprits, bacteria, fungi. The CL stands for two active ingredients: clindamycin, clotrimazole. Clindamycin fights bacteria. Clotrimazole treats yeast infections like Candida. Simple diagram showing dual action of Vagid CL against both bacteria and fungi, primarily indicated for women with symptoms like abnormal vaginal discharge, itching, soreness, burning sensation. These often signal an imbalance in vaginal flora. It's a suppository, inserted directly into the vagina. The standard course of treatment is usually one suppository inserted into the vagina once daily, preferably at bedtime. Using it at night is recommended because lying down for several hours allows the suppository to dissolve completely and remain in the vaginal area, ensuring the medication is fully absorbed without leaking out due to physical activity. Before using the suppository, it is very important to wash your hands thoroughly with soap and water. The suppository is usually inserted using a special applicator that comes with the medication. You should lie on your back with your knees drawn up towards your chest. Gently insert the applicator deep into the vagina and press the plunger to release the suppository. Afterwards, withdraw the applicator and dispose of it as instructed. Remember to complete the full course of treatment prescribed by your doctor even if your symptoms start to improve before you finish all the doses. Stopping the medication early can lead to the infection not being fully cleared. The typical duration of therapy with Vagid CL is often 3 to 7 days. Consistency is key. Try to use the suppository at the same time each evening to maintain a steady level of the medication in your body. While Vagid CL is an effective medication, it is not suitable for everyone. There are certain situations, known as contraindications, where its use should be avoided. The most important contraindication is a known allergy or hypersensitivity to clindamycin, to clotrimazole, to any other component in the suppository. If you have previously had an allergic reaction, such as a rash, severe itching, or swelling to these drugs, you must inform your doctor. Additionally, individuals with a history of inflammatory bowel disease, Crohn's disease, ulcerative colitis should use this medication with caution. Medications in pregnancy require careful consideration. Clotrimazole, the antifungal component, is generally considered safe for use during the second trimester of pregnancy, for use during the third trimester of pregnancy. However, the safety of clindamycin, the antibiotic component during pregnancy, is less established. Studies have not shown a clear risk, but it's usually used only when the benefits to the mother outweigh any potential, though small risks to the developing fetus. If you are pregnant, think you might be pregnant, or are breastfeeding, it is absolutely critical to discuss this with your doctor before starting Vagid CL. Like all medicines, Vagid CL can cause side effects, although not everyone will experience them. Most side effects are mild and localized to the area of application. The most common ones include a slight burning sensation, itching, irritation in the vagina or vulva immediately after insertion. Some women may also notice mild cramping pelvic pain. These symptoms are often temporary and may resolve as your body gets used to the medication. In rare cases, more significant side effects can occur. Because Vagid CL contains clindamycin, there is a small risk of pseudomembranous colitis, severe diarrhea, abdominal pain, fever. If you develop severe, watery, or bloody diarrhea during or after your treatment, seek medical attention immediately. So how does this medicine actually work on a biological level? This is a field of study called pharmacodynamics. Each component has a distinct job. Clindamycin works by inhibiting bacterial protein synthesis. Clotrimazole, the antifungal agent, works differently. It targets the fungal cell membrane. Before we conclude, it is important to touch upon pharmacokinetics and potential drug interactions. With Vagid CL, absorption into the bloodstream is minimal because it is applied locally as a suppository. Despite its low systemic absorption, there is still a possibility of interactions with other drugs. We have covered a great deal of information today, from what Vagid CL is. Our goal at UMCC is to demystify medicine. Thank you for joining us today at UMCC Medical Consultant Connectors. If you found this information valuable, Please help us reach more people by liking this video, subscribing to our channel for more medical insights, and sharing this content with your friends and family who might benefit from it.